Welcome back to Catalyst University. My name is Kevin Tokoff. Please make sure to like this video and subscribe to my channel for future videos and notifications. And a big thank you to my patrons on Patreon for your contributions to my channel. In this video, we're going to be focusing on the major functions and branches of the vagus nerve, in particular that reside within the head, the neck, and the thorax. And we're going to do this with an emphasis on these nuclei over here that reside within the medulla oblongata. So at the end of this video, hopefully you'll have an understanding of all of this. But before we go any further, I think it's actually going to be helpful to take a look at this picture first. So over here we have some of the major structures over here, many of which are going to be innervated by the vagus nerve. Now if we look over here, these represent three important nuclei within the medulla oblongata. We've got the nucleus ambiguus, the dorsal nucleus, and then the solitary nucleus. There is another one we're going to look at later called the spinal nucleus or the trigeminal nerve. However, these three are very important for the glossopharyngeal nerve, cranial nerve 9, and then the vagus nerve here, which is cranial nerve 10. And the basic idea here is that we have these afferent nerve fibers that are coming from these various regions all throughout the periphery. And they're relaying sensory information back to the medulla oblongata. So you can see the flow of sensory information. And in general, the sensory information is going to come back to the solitary nucleus. So this is almost entirely a sensory nucleus. And you can remember the S for solitary is S for sensory. So that's the solitary nucleus. And then we have the nucleus ambiguus and the dorsal nucleus. These are motor nuclei, and their nerve fibers are going to be efferent fibers that are sent out from the medulla to the various regions that we just talked about on the previous slide. In general, the nucleus ambiguus is going to have motor innervation for structures above the trachea, with the exception of the heart right here. The heart actually has fibers coming from the nucleus ambiguus. And then the dorsal nucleus is going to get structures including the trachea and below, of course, with the exception of the heart right here. And so hopefully you can see the logical flow of these nerve fibers. All these afferent sensory fibers come into the solitary nucleus, then the motor fibers coming from the nucleus ambiguus and the dorsal nucleus out to the periphery. Now the dorsal nucleus is also called the dorsal motor nucleus, and there's a distinction because in some older literature there was some sensory fibers coming into the dorsal nucleus, just like it did for the solitary nucleus. However, the vast majority of the dorsal nucleus is known to be motor, and so for that reason it's just sometimes simplified to dorsal motor nucleus. So when you look this up on the internet, you'll actually see both pieces of terminology. I'm going to call it the dorsal motor nucleus here for simplicity. Now we'll talk about the important functions and branches of the vagus nerve. So over here on the right side of the screen, I have the medulla oblongata in gold here, and we've got the four important nuclei here in no particular order. This one's not necessarily superior, this one's not necessarily inferior. And we have the spinal nucleus of the trigeminal nerve. This V is the trigeminal nerve, cranial nerve 5, right? This one is the dorsal motor nucleus. We now have the nucleus ambiguus and the solitary nucleus on the bottom. Now, the medulla oblongata is, of course, part of the brainstem and therefore resides within the cranium. So just some foreshadowing. When we see these nerve fibers come off of these various nuclei, in order to get to the periphery, they're going to have to exit the cranium. And all of them are going to exit the cranium via the jugular foramen. Okay? And, of course, I have all these fibers drawn separately, but in reality, they're going to all travel together as the vagus nerve. And we'll see branches that come off periodically, okay, but I just wanted to remind you of that they are traveling as the vagus nerve unless we see a branch, okay? So let's now get to it. We'll start off by talking about the fibers associated with the spinal nucleus of the trigeminal nerve. And these are going to be sensory in function, okay? So we're going to start out over here with the structures that they innervate. So these nerve fibers right here are providing sensory information regarding the outer and the middle ear. If we want to get really specific, for the outer ear, we're really talking about this area of skin right here, just surrounding the external acoustic meatus. The rim, no, that's not going to be the vagus nerve, and neither is the lobe down here. Really just this area around the external acoustic meatus. Also, there is some on the walls of the auditory canal right here. And then there's also sensory information provided from the inside of the tympanic cavity, that is the middle ear. And all of these branches right here are going to converge as the auricular branch, auricular referring to the ear. They're going to pass through what we call the superior ganglion right here, as are a lot of these other branches that come off of the vagus nerve. And that's going to move back here through the jugular foramen. And of course, those fibers are going to go to the spinal nucleus of the trigeminal nerve. Now in this figure, we have the jugular foramen right here, and over to the right over here, this is assumed to be the cranial cavity. And within the cranial cavity, we of course have meninges. Those are associated between the bone and the brain, the neural tissue, right? And there's three of them. We've got the dura mater, the arachnoid mater, the pia mater, right? And if someone were to have something like meningitis, where there's inflammation or maybe even tissue damage to the meninges, the brain should be aware of that. So if you look here, within the cranial cavity, there are some nerve fibers that are actually sensitive to things like pain. And so they pick up that information, and you'll notice they actually exit the jugular foramen out into the periphery. So they actually leave the cranial cavity, and they come back here and go to the superior ganglion. Well, from there, they actually loop back, and they go back through the jugular foramen into the cranial cavity, and then come back up to the spinal nucleus of the trigeminal nerve. So that meningeal branch is actually a little bit weird, because it's sensing something within the cranial cavity. It then leaves the cranium, loops around, and then comes back into the cranium. And that's the only one here that does anything like that. Okay? So we've seen the auricular branch, we've seen the meningeal branch. These are the only two that ultimately are going to come back to the spinal nucleus of the trigeminal nerve. What about the dorsal motor nucleus? Well, it does send efferent fibers out, but we're going to have to wait until part 3 to see that. So make sure to look for that video. The reason we're not going to see that here is we're focusing on the head, neck, and thorax. But remember, the dorsal motor nucleus hits things below the trachea, so more in the abdominal and the pelvic region. So there's going to be nothing here that's innervated by efferent fibers coming from this nucleus. Now, the fibers associated with the nucleus ambiguus and the solitary nucleus are going to be closely tied together. So the nucleus ambiguus is motor. It sends out efferent fibers. So we're looking at these come out. They're going to exit the cranium through the jugular foramen. They're going to go through the superior ganglion. And then they're eventually going to reach something down here called the inferior ganglion. Okay? And then from there, you'll see various branches to different structures. Okay? Now for the solitary nucleus, this is going to receive afferent fibers. So they're going to be going the opposite direction as those from the nucleus ambiguus. So if we begin with the inferior ganglion, the gold ones are going to come back up here. They're going to go through the superior ganglion, come back into the cranium through the jugular foramen, and then ultimately to the solitary nucleus. But we're going to see a lot of mixed nerves coming from this inferior ganglion, and they're going to contain both the efferent fibers coming from the nucleus ambiguus and afferent fibers ultimately coming back to the solitary nucleus. Let's take a look. Now this first one is going to be purely sensory, and it's concerned with taste. So we're looking at special visceral afferents, SVA fibers. So when we think about taste, we're normally thinking about the tongue, right? If we consider the posterior 1/3 of the tongue, that's going to be the glossopharyngeal nerve. And then the anterior 2/3 is the facial nerve. But there are some taste receptors in some other structures, like in the epiglottis over here. There's not a lot, but there are some taste receptors there. And then over here, this is meant to show in the pharynx. This isn't going to muscle because it's afferent, right? So there are some taste receptors in the pharynx. So any tastants that bind to those taste bud receptors, that information travels back through here from the pharynx and from the epiglottis, ultimately back here to the inferior ganglion. And then that information is relayed back to the superior ganglion, back through the jugular foramen, ultimately to the solitary nucleus. Next, we have one that's purely motor. It's efferent. So those efferent fibers ultimately come from the nucleus ambiguus. We follow those out through the jugular foramen, through the superior ganglion, down to the inferior ganglion. Then the inferior ganglion here is going to give off a branch called the pharyngeal branch, which is obviously going towards the pharynx. And this branch is actually going to run with two that I haven't shown, but there's going to be a branch of the glossopharyngeal nerve, number 9, and the spinal accessory nerve, cranial nerve 11. They're going to kind of run together. and they're going to reach the pharynx, and they're going to form a plexus, a network of nerves that innervate a lot of these constrictor muscles. For example, you have the superior, middle, and inferior pharyngeal constrictors. And then up here you have the levator villi palatini muscle. Now, the tensor villi palatini is actually innervated by a branch of the trigeminal nerve, not the vagus nerve, but you do have levator villi palatini and then all these pharyngeal constrictors. And so the pharyngeal plexus is going to innervate those muscles which help with swallowing and moving a bolus of food from the oral cavity down into the esophagus. Next, we have the superior laryngeal nerve, which comes from the inferior ganglion right here. This is our first mixed nerve that we have. And this nerve by itself really doesn't do much other than bifurcate. The bifurcation here of the superior laryngeal nerve is pretty intuitive. It just so happens that one branch of it is going to be the afferent nerves, and the other branch is going to be the efferent. We'll cover the efferent ones first. The efferent branch of the superior laryngeal nerve is the external laryngeal nerve. External for efferent. Both start with an E. This is motor and goes to serve two muscles within the larynx. The first is not shown in this picture. It's the cricopharyngeus muscle. And the other one, right here, there's a left and a right, is the cricothyroid muscles. Both of these muscles, like the others that we'll see later on, are involved in phonation, basically speech production. Okay? But the vast majority of those laryngeal muscles are innervated by another nerve that we actually haven't seen yet. This is only getting two of them. The other branch of the superior laryngeal nerve is this one, which is associated with the afferent fibers. This is the internal laryngeal nerve, and it's going to provide sensory innervation for structures in the larynx above the level of the vocal cords. So the vocal cords are approximately right here. And so above that, sensory innervation is from the internal laryngeal nerve. Okay? If we're looking at sensory innervation below the vocal cords, that's going to be a different nerve that we're going to see actually in a couple of slides. Okay? Now, of course, the vagus nerve is going to go much more inferior to this, all the way down to the abdominal cavity. So from the inferior ganglion, we really just have a continuation of the vagus nerve going inferior. So from the inferior ganglion right here, we see the continuation of the vagus nerve. This structure that's next to it is the esophagus. And understanding that the vagus nerves are going to be near the esophagus as we go down toward the diaphragm is going to be really important once we make the transition from the thoracic cavity to the abdominal cavity, but that's something we'll cover in one of the other videos on the vagus nerve. Down here, the vagus nerve is going to give off a recurrent branch. This is the recurrent laryngeal nerve. Normally, recurrent refers to some branch of a nerve or artery or other structure that branches off more distally and then has to loop around and go back more proximally. So let's take a look at that right here. So we're all the way down by the arch of the aorta. So down here would be where the left ventricle pumps blood into the aorta. So this would be ascending aorta. This is the arch of the aorta. And then from here down, which is not shown to be the descending thoracic aorta. Okay? And remember that we have three large arteries that branch off of the abdominal aorta. The first one is right here. It's actually very small in this picture, but it's this one right here. This is the brachiocephalic artery. The next one that comes off is this one, which is the left common carotid artery. And then this one is the left subclavian artery. And then just remember that this brachiocephalic artery, after it comes off of the arch, is going to bifurcate into two other branches. Those are going to be this one that goes toward the head, which is the right common carotid artery, and this one which is going to go to the right upper extremity, which is the right subclavian artery. Now, why do I go into all that? Because we have a right and a left vagus nerve, and each of these is going to give off a recurrent laryngeal nerve. But this is a case where we have a dimorphism between the left and the right. They're not symmetric. So if we look at the right vagus nerve right here, it gives off a right recurrent laryngeal nerve. And notice that where it comes off is right underneath the right subclavian artery. It loops under the right subclavian artery and kind of crosses behind where the brachiocephalic artery bifurcates and then goes back up, of course, to the larynx. The left vagus nerve actually descends a little bit more inferiorly before it actually gives off the left recurrent laryngeal nerve. So the left vagus nerve here crosses kind of over the region where the left subclavian artery comes off. That's where it gives off the left recurrent laryngeal nerve, and it loops really underneath the arch of the aorta right here. And then it comes back up to the larynx. Now, one clinical implication of this is for an aortic aneurysm. So an aneurysm is when an artery, its walls become weak and it kind of balloons out. So it becomes much wider. You can think of it almost like an extremely excessive dilation because the walls are weak. And this is not a AAA. A AAA is an abdominal aortic aneurysm. That's part of the aorta way down at the bottom of the abdominal cavity. When we say an aortic aneurysm, we're usually referring to the aortic arch right here. And that poses a problem for the left vagus nerve because not only does it cross over the arch of the aorta, but this left recurrent laryngeal nerve crosses and loops around the aortic arch. And so both of those nerves can actually become damaged in the case of an aortic aneurysm. But understand that both vagus nerves have a recurrent laryngeal nerve, but they do branch off of the vagus nerves at different points. Now, with the recurrent laryngeal nerves, they're mixed nerves, so they have both a motor component and a sensory component. For the sensory component, we're talking about sensory innervation for the structures in the larynx below the vocal cords. So remember the vocal cords above that was the internal laryngeal nerve, which then came back to the superior laryngeal nerve. Well, below the vocal cords, all of this part of the larynx would be the sensory part of the recurrent laryngeal nerve. So that information is relayed back here, up the vagus nerve, and back to that inferior ganglion, and then ultimately, you can't see it here, but back up to the solitary nucleus. Now, for the motor part of the recurrent laryngeal nerve, we have to consider two things. One would be the general visceral efferent fibers, and those are going to go to the esophagus and the trachea. And the basic idea of those is those are going to trigger certain cells of the esophagus and the trachea to start making mucus. And the mucus, of course, is going to line the lumen or walls of those structures for protection and other purposes. Now remember up here when I mentioned the external laryngeal nerve innervates a couple of these laryngeal muscles, those being the cricopharyngeus and the cricothyroid muscles? Well, those are only two of several laryngeal muscles. All the other laryngeal muscles are actually innervated by the recurrent laryngeal nerve, and it's actually through a branch here, which would be the inferior laryngeal nerve or inferior branches. And this is going to divide to basically give innervation to all of these muscles. For example, thyroepiglottic, thyroarytenoid, aryepiglottic, oblique arytenoid, transverse arytenoid, posterior cricoarytenoid. There's also a vocal muscle called vocalis and the lateral cricoarytenoid muscles. So again, these two over here are innervated by the external laryngeal nerve, and then all the others, which is actually most of them, are innervated through this branch of the recurrent laryngeal nerve. Now right here, here's a small segment of the carotid area. So down here we have the common carotid artery, and of course it's going to bifurcate into the internal carotid artery and the external carotid artery. And then up here, kind of at the top of that bifurcation, is the carotid body. And not shown here would be the aortic arch, but that's of course in the aorta. And within these structures are chemoreceptors that monitor the pH of the blood and other things related to the chemical composition. And we need those because if the chemical composition gets out of whack, well, then we're probably going to die, right? If the blood gets too acidic, we need to help bring the pH back up. If the blood gets too alkaline, we need to help bring the pH back down. And so that information regarding pH and chemical composition through chemoreceptors is relayed back to the inferior ganglion right here via this nerve, which is called the sinus nerve of the vagus nerve, or sinus branch of the vagus nerve. And again, from there, from the inferior ganglion, it will go back here, ultimately to the solitary nucleus of the medulla oblongata. And that lets the brainstem, and therefore the brain, know about the chemical composition of the blood and if we need to initiate a reflex to help bring the pH back into normal levels. Now, the only other thing I wanted to mention in this video that's going to kind of lead us into talking about the vagus nerve in the abdominal cavity is the vagus nerve as it goes down the esophagus. Now, obviously, the esophagus is going to penetrate through the diaphragm, and eventually it's going to become continuous with the stomach, right, in the abdominal cavity. Now, the vagus nerves, both left and right, are going to follow the esophagus, and they're actually going to maintain close contact with the esophagus. And it turns out that the left and right vagus nerves, as you go down the esophagus, will start interchanging fibers. And so some of the left vagus nerve fibers will cross over to that of the right vagus nerve, and vice versa. And so once the vagus nerves get into the abdominal cavity, they actually change names to what we call the anterior vagal trunk, which resides on the anterior surface of the esophagus, and the posterior vagal trunk, which is obviously behind the esophagus. And it turns out that the posterior vagal trunk is going to be mostly fibers from the right vagus nerve, but some from the left. And the anterior vagal trunk will be mostly the left vagus nerve, with some contribution of the right vagus nerve's fibers. But we'll pick up with that when we talk about the vagus nerve's function in the abdominal cavity. And that's where we'll see the functions more of the dorsal motor nucleus. See you then. Thanks for tuning in. Please like, subscribe, and check out my Instagram for cool science and not science stuff.